So today we're going to talk about tooth decay or cavities or caries, the process that is a result of degradation of your hard tissue of your tooth in the mouth because of a metabolical products of the bacteria that have been active because of accumulation. So if you stay at the end of this video, you will learn more about cavities or caries or dental decay, so you can learn better of it and learn how to properly prevent it and to have a much longer and healthier smile. So stay tuned. When we talk about cavities, it's one of the most spread disease in the world because probably every person had it and every person will have it in some point of view, because today we are surrounded by different types of foods that are really rich in carbohydrates or in sugar, and every now and then there's a food retention area where the teeth can be not so easily cleaned. Then you end up receiving a heart of plaque accumulation where cavities can form there. So what are dental cavities? What is caries? What is tooth decay actually? So the idea, not the idea. So the concept is this next. You have normally over 700, I also mentioned it in previous videos, you have over 700 types of different bacteria in your mouth living in normal harmony, and everything is in some sort of balance, we can say. But if the balance goes off via infection, via food retention or some other source that causes a shift in balance in those bacteria, let's say one bacteria grows more because it has better food, more richer environment with food from your own food that you ate, and you did not clean your teeth well. So the bacteria uses this food, this plaque that is left on your teeth, and uses it as her own energy source. With the metabolism of the bacteria, the byproduct of that metabolism is different sorts of acids that are there formed on the surface of your tooth, especially enamel. So when time passes by, if time passes by, you do not clean those teeth, the bacteria's metabolism constantly is damaging the surface of the tooth and causing a structural change on the surface. This first part, when the structural change is visible, is called a white spot lesion, you can call it. Why? Because the enamel, the crystal structure of the enamel is changed via the acids from the metabolic products, and it's a partially or even sometimes full reversible effect that can be healed properly if the food is removed on time, and if the bacteria is removed on time, and if you then use toothpaste with fluoride or some other ingredients. But this is really rare. Most of the time it stays like a white spot lesion, and it can be strengthened with fluoride toothpastes or stuff like that, but it's never going to be back the same as best. We go further than the white lesion, and then why is it called a white lesion? Because the structure of the crystal structure of the enamel and the dentin changes because of the acids. So the acids dissolve that crystalline structure, and this is what you can see like a change in color. You can see it like a more whitish, milky color than this transparent color which enamel usually is. So it goes down. And also how the cavity forms. Also, the bacteria follows then also, because cavities are a product of bacterial metabolism, and bacteria then goes also in the pores that are made from their metabolism. So bacteria go deeper and deeper in the layer of the tooth because of it. How they go deeper in the layer? They produce more and more acids if you provide them with more food. So actually, when we talk about dental caries, dental cavities or tooth decay, it's a chronical disease. So if it has food, if there's food on it, bacteria will produce acids on it, and it will decay even more and more. If you remove food from it, your own food that you ate, then the metabolism stops at some point, you know. So it's a cause-effect type of chronical disease. You have a cause, food, you have an effect, metabolical effects of the bacteria. You remove it, you don't have it. So you can stop further dental decay if you have developed one with proper tooth cleaning at that moment. This does not mean you don't need to remove that damaged enamel and structure, because it has a higher retention rate than your normal enamel and than your fillings to retain bacteria inside that can cause damage to your tooth even further. So how it progresses even further and further. If it progresses and it goes lower and lower and lower till it reaches your dental pulp, which then can cause pulpitis or other types of pulp disease, which in 99% of the cases will result in a endodontical treatment. If you want to know what an endodontical treatment is, what a root treatment, that's a root canal treatment is, you can check my other video regarding this topic to learn more about the root treatment procedure. But if you want to check out my video around tooth fillings also, we will talk about this thing also. So, after this effect has occurred, after the cavity has formed, and you come to our office, we use usually a dental anesthesia if it's necessary. Because why? Sometimes the dental anesthesia is not needed, but this is something that we do not know. Sometimes the patients ask in advance for anesthesia. Sometimes that's good, sometimes it's bad, depending on the case. This is a professional topic that we will not discuss here. But why does the tooth hurt when cavities form, and why does the tooth hurt when you drill? Well, obviously, but when you look at the under the microscope, you can see that your enamel has no nerve endings, so the enamel does not hurt. But the dentin itself is like a well-organized sponge, let's say. It looks like that, through which those canals, those tubules that you can see under the microscope, there's a nerve ending that goes through it with a cell. So this thing then hurts if you touch it, you press it, you drill it, you fill it, or you infect it with the bacteria. This is when we say that the tooth can hurt because of it. As deeper you go, the more and more nerve endings are found, and of course more and more hurts there. So when the bacteria or the drill goes through the dentin into the pulp, then that is where the pain happens most of the case, because you're directly hitting the nerve. Endodontical treatment also needs to be done, but if not, you can only do the drill and fill procedure, which is a normal dental filling. If you want to learn more about dental fillings and how they are done, you can check out the video regarding dental fillings and what types of dental fillings are today available on the market, and what are the pros and cons of all dental fillings. Toothache, one more side note, toothache can not only happen because of cavities, toothache can happen from very different sources or irritations. So the pain from the tooth or destruction of the enamel can happen from acid food, from your own acid from the stomach, if you have something called a gastrointestinal reflux disease, also called GERD, from some type of immunosuppression diseases, also can cause different types of pain, which can be then which you can think then it's a toothache, but it's actually something else. The thing is if the infection spreads from the toothache, if the bacteria goes from the enamel through the dentin into the pulp to the bone and further, it can cause from mild pain to severe pain to infection of the bone, periapical abscess or periodontal abscess, or even spread further to surrounding tissue, to big head and neck abscesses. They can be really life-threatening and sometimes even cause death. So be sure, if there's anything that you suspect, please contact your dentist and make an appointment to clear those things up. I hope you like my video. Please click the like and subscribe button for more future content, and check my other videos also to learn more about dentistry and to give you more information on how to preserve your teeth even better with proper information. I hope to see you soon. Bye.